Good morning, Tribe. Chelsea here with Tribe RN, and I am so excited to introduce Marcus here. He is going to speak with us about his experience as a former trauma patient and his role in healthcare as it is now. Welcome, Marcus, and Elliot there with you.
Thank you, Chelsea. And yes, this is Elliot, and Elliot might just decide to lay down here and take a nap. Elliot's my CNI dog, so he likes to stick pretty close by my side. And he's also still a little bit of a puppy, and he whines a lot. He talks a lot. He's very vocal. So if he gets interruptive during this, please just understand he's still a puppy.
Awesome. We don't mind a little puppy love.
Yeah.
So tell us what encouraged you to share your experience with healthcare workers, and or maybe you can start with what happened. That might be a great
Sure.
opening.
Yeah, sure. Thank you guys so much for tuning in today. Just for the record, I am not an RN. I am not a healthcare professional of any sort. However, I do have a master's in a very niche field called narrative medicine, and I have a lot of time at the other end of the stethoscope as a survivor of massive trauma. So a little bit about me. I'm 43 years old. I live in Orlando, Florida, hence my shorts today. And I am a native of St. Louis, Missouri. Grew up in St. Louis until I was about 10 years old. And at that time, my parents moved our family to the rural farming community of High Hill, Missouri. And when I was growing up in High Hill, Missouri, I was not the person that you see in front of you today. When I was coming up, I lived a very normal existence. Whenever it was time for me to go off to college, I took off for my freshman year at Missouri State University. And about 6 weeks into my freshman year of college, I got homesick, came home for the weekend, and on a Saturday night, went into St. Louis to meet up with friends who I had met during my high school years when we all attended the same church camp together. And on a Saturday night after a St. Louis Blues hockey team, hockey game, my friends and I were driving home, and we were struck broadside by another car. That car happened to be driven by a driver with a blood alcohol concentration of 0.17. That reading was taken 4 hours after the crash. So
Wow.
from the moment that I saw those headlights of the oncoming car were the last things I ever remember seeing. And I know that we had a comment whenever we were posting about this a day or two ago. One of the tribe members asked, "What do you remember?" And
Mhm.
I, as a survivor of massive trauma, I think whether you are a survivor or you just know a little bit, we have this beautiful gift built into the human psyche that's called shock. And I don't know if I ever truly went into shock, but I definitely remember certain points of the trauma and the points soon following after. Like, I don't remember the impact of the crash, but I do remember waking up face down, stomach down, chest down in the street. And whenever I came to, I could feel all of the bones in my face just as crushed as if you'd taken a paper cup and crumpled it up as tight as you can.
Mhm.
I remember very vividly the taste of blood and gasoline. I remember not being able to breathe. I remember pain. I remember darkness. And I remember thinking that I was going to die. Luckily, that crash site was only 3 miles away from a level one trauma center. So,
Mhm.
as if I didn't need a level one already, it just so happened that the trauma center at Barnes Hospital, now known as Barnes Jewish Hospital, it's Washington University's hospital in St. Louis. Whenever they pulled me into the emergency room that night, to say that I was hanging by a thread might be an overstatement. People say,
Mhm.
"Oh, well, what was the actual damage?" And what had happened is, I during that crash, I received what is called a Lefort 3 fracture. And if you're not familiar with that term, it's a surgical term, and it pretty much means that every bone between the hairline and the chin is completely crushed. While
Wow.
I was laying in the street that night, the broken bones and the swelling in my face were so severe that it was starting to cut off oxygen. And the lead paramedic on that ambulance crew that night had to perform the procedure that is the last ditch effort to save human life. And there in that street, he made the incision in my throat that is the reason that I am alive today.
Hmm.
So to give you a little bit more of the story then, from that intersection, I was transported by ambulance to the emergency room at Barnes Hospital. And I really only remember a couple of things from the ER. Number one, I remember having my clothing cut off. And number two, I remember Jennifer. That first night of hospitalization is such a blur of pain and suffering and darkness and terror. The one thing that though that gave me a little bit of comfort was the fact that throughout that night, every time I came back to consciousness, I could tell that somebody was holding my right hand. And the owner of that hand, every time she could tell that I was conscious, she would say the same things to me, and she would repeat the same thing. She'd say, "Marcus, you were in a car accident. You're in the hospital." And then Jennifer would repeat the two most compassionate words I think that any human being can say to another. And she just kept saying over and over as she held my hand, she just kept saying, "I'm here. I'm here, Marcus. I'm here." I didn't even know where here was, but I knew that I was not alone. And whenever I'm
Mhm.
working with nurses around the country, whether I'm in my role as a professional speaker or lecturer, or I'm doing these kind of Facebook lives, whatever the case may be, I'm always reminding people that the cornerstone of caregiving is human presence. That when we can be intentionally present in that moment of suffering with our patients and the families of patients, that is essentially the foundation of not only who we are as healthcare professionals, but who we are as human beings. It's that
Mhm.
ability to be present for another person. Um, that was the greatest amount of comfort that any person could have given me that first night in the emergency room.
Absolutely. And so you do a number of things to share your experience and have several platforms. What all do you do to help spark that compassion in healthcare workers? You mentioned briefly your role in narrative medicine. Do you want to elaborate a little bit on that?
Certainly, certainly. So narrative medicine is a very narrow field. In fact, there's only one narrative medicine master's program in the country. That's at Columbia University in New York City. And whenever I received my master's in 2012, my class was only the third to graduate from that new program. So it's a very new and still emerging field. And what we do in narrative is we take the stories of healthcare and we try to turn them into something that people can learn from. So, what I do in healthcare is I do a few different things. Number one, I'm a keynote speaker. I go around the country to hospitals and nursing conferences and healthcare conventions, and I tell my experiences as a patient and what are the little things that healthcare professionals, specifically nurses, but really anyone across the gamut of healthcare. I talk to them about what are the little things that we can do, what are the little tips and tricks for communication that are going to help our patients feel that their caregivers are present with them, that they are being intentional, and that they are truly listening and witnessing the suffering of patients and families. So I do keynote lectures. And then the other thing I do is I do a lot of workshops with nurses to help combat compassion fatigue and burnout. I think it just takes a couple of glances through journals and some evidence-based studies to see that there is such a great deal of stress and burnout and compassion fatigue within the field of nursing. And so nurses, doctors, paramedics, these are the people that literally saved my life and helped me rebuild following not only the trauma of every bone in my face being broken, but also bilateral sight loss. So one of the things that I do is with nurses and with doctors is to lead workshops where we use writing and reflective journaling as a therapeutic practice for hopefully keeping stress and compassion fatigue and burnout in check. And then hopefully that also helps nurses and anybody else, really, anyone that deals with patients, helps them create a record of just what you do. You know, burnout happens when we feel like we're just not making a difference anymore. And whenever you journal and you keep a written record of even a very short thing, like if you just write every day, what is the high point of my day? What was the thing that if presented with the same situation tomorrow, what would I do differently? And pretty soon you've got a running log of all the good things that you have done and all the changes that you have made to stay more present and intentional with patients. And hopefully then that acts as a stress reliever as well. So then the other thing that I do is about a year and a half ago, I became an adjunct professor at University of Notre Dame, and I teach pre-med students in what is called the Pathos Project. Pathos being Greek for suffering. What we do is teach these pre-med students how to truly be with another person while they're suffering, just like Jennifer was with me that night. And so what we do is we take these still undergrad students through how do we show that compassion? How do we show that presence and intention to the patients that we're serving? And how do you do it from one patient who is in the clinic or the hospital for something that they had no choice in? It's a chronic illness or it's a disease or an injury. And how do we compare? How are we then able to walk out of that room into the next room and leave the past in the past and solely focus on the person that we're taking care of in that moment? So that's one of the cool things that I get to do in the academic world. And I don't know, I guess that pretty much about sums up me. Oh, and then I've also written several books that are being used by I don't know, probably 50 or 80 nursing schools and allied health programs across the country to teach compassionate communication and patient care. So I do a lot of stuff.
I love a ton of stuff. What prompted you to soar in this field after tremendous, loss and this experience? What prompted you to make something positive of it? I love it. It's amazing. How did that come about?
Well, how that came about is I think that everyone who goes through something traumatic and life-changing, there's always a desire to redeem those experiences, those negative experiences. And sometimes redemption simply means, well, okay, nothing good came from this situation, but at least this is what I learned from it. So that learning is something good. Whenever I first started speaking and sharing my story, I only worked in high schools and colleges, and I was really trying to get young people just to be smart, not to go out and make unhealthy or unwise decisions. And really that kind of morphed into healthcare along the way, because sadly as it is, we still kill 10 to 15,000 Americans every year by DWI. There's a lot of people out there who can talk about traffic safety and sober driving and things like that, but there's not a lot of people who have survived the massive amount of trauma that I did. And so I want to be able to share those experiences as a long-term patient, just to help those bedside caregivers, those hands-on caregivers to whom I owe my life. Whatever I can do to help re-energize and remind nurses and docs and PTs and OTs and RTs, whatever I can do to remind them of their why. Why did you choose to dedicate your life to this professional experience? If people are getting something out of my experiences that they can apply to their professional and personal life, to me, that is the answer to that ultimate question of why, which I think so many people ask when something horrible happens to them. Everybody asks why. Well, what did you learn from this, and what can you do with this experience? And hopefully, I'm doing something good with my experiences.
Yeah, it's awesome. So a few of our Tribe RN members did enter some questions, and you can take these however you'd like and run with them. But someone says, this is obviously your worst experience. How did you work through it? You've kind of touched on that. I don't know if you have something more you want to elaborate.
My worst experience, how did I work through it? There's when you go through something as devastating and life-changing as I did, there's a lot of one step forward, two steps back, right? It's a long process, it's a long journey, it's a long road to recovery. I think one of the things that really helped me get through it was an experience that I had. It was about 4 o'clock in the morning, about a month after the trauma. I was still attached to a J tube. I still had a talking trach at that time, and I'm laying in a hospital bed. I've got my legs in traction up above the bed. I can't get out of bed. I can't feed myself on my own. I can't I can't go to the bathroom on my own. I can I've got a trach. I can't breathe on my own. And the only thing I could do was lay there in my hospital bed and think and think and think and think. The other thing I could do was listen to music. So it's about 4 o'clock in the morning one morning, and I'm wondering, where's my life going to go after this? How am I ever going to get back to college? How am I going to get back in class? How am I going to do the important things like, get to parties and meet girls and stuff like that? How am I going to pick up the pieces? And that night I was listening to a mixtape. And for those of you who are not millennials, tapes are these cassettes that we used to record music on back in like the 90s. And a friend had made me a tape of a bunch of different music, and a song came on the stereo that night while I was thinking about recapturing life. And it was a Bob Dylan song. Second line of the song, Bob Dylan sang a lyric that said, "Negativity don't pull you through. Negativity don't pull you through." And I thought how much that applied to my life in that moment. I can't sit here and focus on all the negative things that have happened to me. I have to focus on the good things that I still have. Well, what are the good things that I still have? I still have my family. I still have my friends. And then somehow, by the grace of whatever higher power you believe in, I crushed every bone in my face, but I had no signs of any kind of traumatic brain injury. And so with those three things, my friends, my family, and the brain that I still had, I started to try to rebuild my life and to not only get physically healed, but emotionally healed to where I could try to pick up the pieces and just start over again.
Absolutely. So another question that was entered was there ever a point after the accident that you wish you hadn't survived?
Was there a point after the crash when I wish that I didn't survive? I'm sure that there were sometimes. I think that if you go through something like what I went through, and you say that you didn't have any thoughts of suicide or any thoughts of, is this worth it? I think that would be unfair to say that, because there were times that I thought about giving up. And I think one of the reasons that I never wanted to give up is because of the incredible amount of support that I had from family and friends. They had been there with me through all of these most wretched surgeries. And I mean, some of the surgeries that I had were 15, 20, 25 hours at a time. And I had my parents there, and I had my family and my friends, and I thought, if I decide to end my own life, it's going to hurt them severely. It's going to hurt the
Mhm.
people that I love. And I thought how much love that all of my friends and family had poured into me over that time. I didn't want to discredit or disrespect that amount of support. And ultimately, I just chose, there's nothing that can happen. There's nothing I can do that's going to change the past. All I can do is focus on how I can make the future as bright as it can be.
hmm One of the listeners, Tab, said, "Glad you focus on the positive. Sorry you had to endure so much, but at least you are thriving."
Yeah, I'm lucky to be. I am lucky to be alive. I'm lucky not to be severely neurologically damaged.
hmm
I am just lucky all around. I am lucky that not only I survived this and was able to pick up on the pieces of life, but that I am able to, thanks to modern science and modern technology, actually have um, a better life than any blind people have had up to this point in history. So
hmm
I'm a very, very lucky person to also be living in this time right now.
And great perspective. So, I loved the two books that I've read of yours so far. But on the other end of the stethoscope, and I am here. Talk to us a little bit about the healthcare providers that you have had great experience with and how that affected you, and maybe some behaviors or things that us as healthcare providers could improve upon that would make our patients' lives better. Barb specifically was one of your favorite nurses. You mentioned her in the book. I've already told you, but I'll tell the tribe, when I grow up, I want to be like Barb. So tell us all about Barb and any other nurses that you really had a great experience with.
Sure. Okay. So I had a 25-hour facial reconstruction. And after that facial reconstruction, I went to a different ICU in the hospital. The first probably 10 days post trauma, I was pretty foggy, didn't know a whole lot that was going on. And it was after that first 25-hour facial reconstruction that I was moved in the hospital to a different ICU, and I was put under the care of Barb. And when I first met Barb, I didn't really know the drastic impact she was going to have on my life. When I was put into her ICU, she walked up to my bed. She introduced herself. She shook my hand like there was nothing wrong with me, and she said, "Hey, Marcus, my name is Barb, and I'm a nurse here in the ICU, and I get to take care of you for the next 8 hours." And when she used that little three-letter word of "I get to take care of you,"
Yes.
it showed me that Barb understood and appreciated what a valuable role she plays in the healing of patients. She
Mhm.
knows that to be a nurse, it is an honor. You're very fortunate to be able to do this kind of work. This is work that we get to do, right? This is not manual labor like digging ditches. This isn't sales. It's not marketing. This is human beings taking care of human beings, and it's extremely sacred work. And I want to invite all of your listeners and all the tribe to really begin, if you don't already, to begin to see your work as not only valuable to patients and families, but also sacred. I don't know if there's anything more sacred that we can do than take care of human beings who are suffering. So about Barb, gosh, she became my nurse that first day. And even though I still had a trach, even though I was writing everything out longhand, just the way that she talked to me like I was a normal person just gave me so much encouragement that Barb wasn't going to. There were almost some nurses and some healthcare professionals at that time that were almost scared to touch me. And understandably so, because even if you just moved my arm a little bit, it would be just lightning bolts of pain throughout my body. That's just the injuries that were there. But Barb treated me just like not like I was some fragile little being, but like I was a young, healthy 18-year-old guy. And I think part of the reason for that is because whenever Barb was taking care of me, she had two teenage sons, and both of them, being about the same age as me. In fact, one of her sons, and I actually share a name. Her son's name is Mark as well. And so, whenever she told me these things, it's making little connections that make me feel as though Barb totally has my best interests at heart. And through it wasn't just that, but it was in the ways that she went above and beyond her typical amount of care. Barb would call me on her days off and ask if she could stop by a store and pick up anything for me on her way into work. And if there was anything that I wanted her to pick up for me at Best Buy or Target or anything like that. And I just sit there thinking, how lucky am I to have not only ended up in one of the best hospitals in the country, but I also ended up with such a caring, compassionate nurse who saw me as a person, not just as a patient that was on her caseload that night.
Yes, I love Barb. I love everything you have to say about her. In one of the things, I took lots of notes as I was reading your book, but you specifically said at one point, when patients are healing and making even the slightest bit of progress, you recalled Barb giving you all the accolades. And I just thought how great that was. What other tidbits do you have for us as staff to help you as a patient?
Again, these are just some of the little tips and tricks of communication that that can help patients feel like they're on the road to recovery. I think I state in the book that look, even if the person's blood pressure has just gotten a little bit better, it's just gone a couple of points in the right direction. Um, Make that personal. Say, hey, you've really got your blood pressure looking good, or your heart rate or your pulse is just fine. Your oxygen is perfect. When we start giving the credit for those progressions to our patients, it's going to make them feel a little bit more of an ownership and make them feel like they're on their road to recovery. Oh, okay, yes, actually, it was the medication that you gave that is helping the oxygen level or helping the pulse. But if we make it personal to the patients, I think anytime we compliment somebody, I mean, this goes back to the old saying of you attract more flies with honey than vinegar, right? Whenever we compliment and congratulate patients on their progression, their improvements, we're making it personal to them, and I hope that they feel then more motivated to continue their healing process.
Sure. And then another thing that you mentioned several times was the way that the drugs made you feel. Like the nurses could say, I'm giving you Percocet or whatever it was, but to have them actually describe to you how that might make you feel was very important. Do you want to talk a little bit about that?
Sure. I would ask nurses to remember that the vast majority of Americans have pretty low health literacy, right? And I would also ask the tribe members to think about, before you were a nurse or before you ever worked in healthcare, had you ever been prescribed a medic that fell? Or a pharmaceutical that you couldn't pronounce, or maybe you didn't even know what it was supposed to be doing for you. I think we've probably all had that experience. That is the level of knowledge that most patients have. Like I know that I have a cholesterol level, I just don't know what it is. So if you tell me that my cholesterol level is 200 versus 2,500, as a non-healthcare professional, I don't really know what that means. It's not put in context for me. So if when we're talking about to patients, we can say, okay, well, you're going to be getting this drug, let's say Percocet, as you remembered. Okay, Percocet is a narcotic painkiller, and it might make you feel a little woozy. It might make you have some hallucinations, but just, it's supposed to let you relax and ease some of that pain. So giving some of those common side effects, telling what the medication is and how it will benefit the patient. And you could use this not just for medication, but you can use it for therapy of any kind. That, hey,
Mhm.
you're going to be working with Julie, the physical therapist today, and she's going to start helping you learn how to balance standing upright and not using a walker. If we can share that kind of information with patients about what's it going to be doing and how is it ultimately going to benefit the patient, I think that brings in a greater, it makes it more personal, right? It's, you're not going to go through PT today. No, this physical therapist is going to show you the benefits that it's going to have to you. So I really, really love that idea of talking about the benefit to the patient and family too. We've got to realize too, most people, unless you're going into the hospital to have a baby or have a nose job, most patients don't want to be there, right? Most patients are in pain, and not just in pain, but also a lot of times on heavy narcotics. We're also confused because, again, the average person has very low health literacy rates in America. The more we can
Mhm.
explain to patients and the more basic the terminology we use, breaking it down to their level of understanding, I think that's going to help patients feel more in control of their own health.
Absolutely. So important. Tribe viewers, do you guys have any further questions for Marcus? His books are amazing. They were so insightful for me. I hope you guys will pick up a copy and read it as well. Do you have any further tidbits for us, Marcus, that you'd like to share with us as
Tidbits
healthcare
for
providers?
you. There are so many tidbits that are in my two books. I'm Here, Compassionate Communication and Patient Care, and the other end of the stethoscope. I would suggest you go there. You can also, if anybody wants anything, has questions that you don't want to ask in this kind of format or platform, go to marcusengel.com, marcusengel.com, ENGEL. .com, and drop me a contact form or shoot me an email. I'm happy to answer any questions that people have, and whether that's about experience as a patient, if that's narrative medicine or narrative nursing, if you're interested in bringing some inspirational patient experience programs to your facility, anything like that, drop me a line. Other than that, anything else that you have for me, Chelsea?
I have one more question.
One more question.
As someone that was traumatically lost your sight traumatically, how can we as healthcare providers be more sensitive and caring when someone has lost their sight tragically, or even just is visually impaired to begin with? How can we help you? What is exactly things that we can do?
One of the things that, from a very specific standpoint here, this is going to be more specific to those who have any type of visual impairment or sight loss. One of the
Mhm.
things that I always appreciated was when my nurses, my docs, et cetera, would say, "Okay, Marcus, I'm going to touch you on your leg." And then they would touch me, right? Instead
Mhm.
of, because as somebody who cannot see their hands coming towards me, I did not know I was going to be touched, and sometimes
Mhm.
that would be to the face or the head, which I think, as soon, if your eyes are closed and somebody touches you in the head, your immediate response is to jerk away, to
Sure.
react, to recoil. And so
Mhm.
whenever, I think when you're working with patients that have visual impairments, and let's just face it, with the increasing amount of type 2 diabetes in America, with the unfortunate side effect that a lot of times vision loss goes along with that, I think you're probably
Mhm.
going to start seeing more patients with visual impairments. But also to realize that there is a big difference in visual impairments. I am completely blind. I have no light perception, anything like that. You go
Mhm.
from that to somebody who is legally blind, who may, in the right lighting, be able to read a book if it's 12 inches from their face. So you have a
Sure.
very wide variety of levels of sight, and knowing their level of sight, and then also just simply asking the question, how can I best help you? Open that conversation and say, hey, as a nurse, I want to be very sensitive to whether you call it a disability or your impairment or whatever. I want to be very sensitive to that. Can you help me learn how I can best serve you? And hopefully that
Mhm.
person will be able to give you a little tip like, hey, don't touch me if you think that I'm sleeping, because I might not actually be sleeping and I'll jump out of my skin, right? So I
Yeah,
think there's a lot of little things you can do that start with open communication with patients.
absolutely. It's great advice. All right. Does anybody else have questions before? Let's see. We have a comment. I'm excited to read your books. Do you have any other recommendations book recommendations that you'd suggest?
Oh, book recommendations. Absolutely. I read probably 50 or 60 books a year, and a lot of those revolve around things that are going on in healthcare. One of the greatest books that I have read that talks about mental illness is a book called The Memory Palace. It's by Mira Bartok, and this book was one of several years ago. It was one of the books that we read while I was in the narrative medicine program, and it's the best book that I've ever read on dealing with family members with mental illness. Which, let's just face it, if you're working in a long-term care environment, an acute care environment, a rehab care environment, you are dealing not only with the patients but also with their families. And let's never forget the levels of the amount of mental illness that there is in our country right now. So if you can pull up that book, The Memory Palace by Mira Bartok, it's a fantastic book. Another book that I would also suggest is called The Nurses, a year of let me think about healing and hope and with the heroes of the hospital. It's by Alexandra Robbins, who is a journalist, and that's called The Nurses. And that is also a nonfiction book that really delves into many of the problems that nurses face, both on and off the job, but specifically on the job, and how we can better support our nurses.
Awesome. Those are great recommendations. Any other questions, Tribe, before we let Marcus go on about his day? He graciously gave us this time slot for today. And I was reading his books and reached out to him and was like, would you by chance want to give us some of your time? I run this Facebook group. They're a great group of nurses. And he joined the group and was like, yeah, sure. I'll give you guys some of my time. So he so graciously gave us his time to chat with us today. No
Well,
other questions?
and thank you
Go
so
ahead.
much, Chelsea, for running this book, for running this group as well. I love the culture and the supportive nature of the questions and the stories that are shared on here. I really, really love that.
Oh, good. Thank you so much for that encouragement. All right, Marcus. Well, it looks like that's all for today. Thank you again so
Thank
much
you
for
guys
giving
so
us your
much. Thank you,
All right.
Chelsea.
See
Thank
you.
you, Tribe.
All right.
Take care.
Have a good one.